I'm going to talk about headache. Headache is something that affects so many people, and sometimes headache is generalized to be one particular illness or a particular problem. But most headache, there are different kinds of headache, but I'm just going to focus on three. The three major ones that affect basically more people, the young, the old, everybody, is tension headache. Tension headache is the most common headache. It's the one that you get when you, like, all over your head. It's just basically the common headache that painkiller will handle. We have cluster headache. Most people have cluster headache and they don't even understand the difference. So they are taking medication, they are taking painkiller. Cluster headache is not a headache that needs painkiller. Cluster headache is those kind of headaches that comes periodically. It comes on one side and it moves to the other side, and that period, it could last for a week. No matter what you do, it's still there. It could last for a week or it could last for months, and then it stops and stays for months or even up to a year. It doesn't come back again. Then it comes back and you start taking the painkillers, these non-steroid anti-inflammatory medications. Those are cluster headaches. And the third one is migraine. Migraine is those kind of headache. It comes with nausea and vomiting, sensitivity to light. When it comes, you can't look at light, you need to turn it off. You're just in pain, you're miserable. That is migraine. And most of them can be triggered by food or drink or some kind of stress. And all of this has different ways to treat it. If you have cluster headache, for example, and you are taking painkiller, non-steroid anti-inflammatory drug, this is not going to help you. It's rather going to worsen your situation, because non-steroid will lapidate your prostaglandins, which is something that protects your lining, the lining on your stomach. You keep taking this because this cluster headache could last for weeks or months. You imagine taking this non-steroid anti-inflammatory every single day because you're not even getting the result that you need. Non-steroid is meant to be taken temporarily. You have a headache, you pop it and do better, and that's it. Maybe next week or in 2 weeks or in 3 weeks or in a month time, that's when you have another headache and you just get this painkiller and use it. So you have cluster headache and you're using painkiller, it's not going to take care of it, because that is not what it needs. Cluster headache needs different medication. Sometimes it needs steroids, sometimes it even needs a channel blocker, but you're taking the wrong medications. And migraine is the same thing. Migraines, they could give you painkiller and it works for you, but sometimes migraine might be something that for you to reduce your stress. What I'm saying in essence is, if you have a headache and you first of all is take these painkillers, but sometimes you don't even need painkillers. Sometimes you need sleep. Sometimes it's your blood pressure. You have your blood pressure is not under control, so it's giving you headache, and you go ahead and be taking medication for headache. It's not going to take care of it. It could relieve it temporarily, it will come back. You have a headache that is consistently not budging to medication, to these painkillers, you need to have it checked, because if your blood pressure is high, you need to get the blood pressure under control to be able to manage the headache, because the headache is, every headache that we have is trying to tell us something. Either you need to eat, or you need to rest, or you need to sleep, or you need something. So please, I want you to understand different kinds of headache so you don't continue to take painkiller, because painkillers is not something that you or anybody is supposed to be taking on a regular basis.